Have you ever looked at a drop of blood and just wondered how it can tell us so much about a patient's health? Well, it all kicks off with one single fundamental skill, making the perfect peripheral blood smear. So today, we're going to break it all down and really master the art and science behind this incredible diagnostic tool.
Okay, so here's our game plan. First, we need to know what we're aiming for. That's the perfect monolayer. Then, we'll get our tools together and get hands-on with the technique, the push. After that, we'll learn how to make the cells actually visible with staining. And finally, and this is super important, we'll learn how to look at our work and know if it's good or bad. Let's jump in.
Before we even think about touching a slide, we have to get our heads around the main goal. The number one thing, the absolute objective here, is to create what we call a monolayer. Everything we do is to achieve this.
So what exactly is a monolayer? Honestly, just think of it as the Goldilocks zone on your slide. The cells aren't all jammed on top of each other, but they're not scattered miles apart either. They're in a perfect single-file line, which is the only way we can properly see them, identify them, and count them. So what's the big deal? Why do we care so much? Well, it all boils down to one word: accuracy. If your cells are in a big clump, you can't tell what's what. If they're all stretched out and distorted, you might misidentify something. A good monolayer is the difference between a confident diagnosis and, well, a totally useless slide. It is the foundation.
All right, we know our goal is that perfect monolayer. So what do we need to actually make it happen? Let's go over our toolkit. You'll see the list is pretty short, but trust me, every single item is absolutely critical.
And listen, the quality of these tools is just non-negotiable. You might think, oh, a little fingerprint on the slide, what's the harm? Or the spreader has a tiny chip, it's fine. No, it's not fine. Those tiny little flaws are exactly what cause massive problems like streaks and holes, making that monolayer impossible to get. Every detail matters here.
Okay, this brings us to the main event, the technique itself. This is where the magic happens, and it's all about feel and practice. So let's break down what's called the wedge technique, one step at a time.
It all starts with being precise. We're going to place a small drop of blood, we're talking just 3 to 4 millimeters, about a centimeter away from that frosted end of the slide. That little bit of space is our runway. Then, you take your spreader slide and place its edge right down on the slide, just ahead of that drop of blood. We're getting set up for the most important part.
Now this next step is all about one thing: patience. You gently pull that spreader slide back until it just kisses the drop of blood, and then you wait. You'll see the blood magically spread out all by itself along the edge. Now, here's a key tip. Let it spread about 80% of the way across, but not all the way to the edges. Why? Because this protects those bigger, more fragile white blood cells from getting smashed on the sides.
Once the blood is ready, it's time for the push. This has to be one single smooth, confident motion forward. No stopping, no shaking, and really important, don't press down. Just let the weight of the spreader slide do all the work. The second you're done, you immediately start waving that slide in the air to dry it. You have to be fast, or the cells will start to shrink and look weird.
Okay, now here's where we go from good to great. This technique is not one size fits all. You have to adapt. A good indicator is the patient's PCV, or packed cell volume. So if you have an anemic patient, their blood is going to be thin, right? So you need to increase your angle, make it steeper to keep the smear from being too long. But for a dehydrated patient, their blood is thick and sticky, so you do the opposite. You lower the angle to help it spread out. Nailing this adjustment is a real game changer.
So we've got this perfectly made smear. Awesome. But if you looked at it under a microscope right now, you'd see, well, pretty much nothing. The cells are clear. So our next job is to bring them to life with some color. It's time to stain.
A really common way to do this is with a 3-step stain. First up is the fixative. That's methanol. Think of it like a biological glue that sticks the cells onto the slide so they don't wash off. Next, we dip it in the red eosine stain. This one colors things like the hemoglobin in red blood cells. Then, it's into the blue and purple methylene blue, which stains the nucleus in our white blood cells. A few dips at each, a gentle rinse, and our cells are finally ready for their close-up.
But, and this is a huge heads up, especially for my vet techs out there, you have to know what your tools can and can't do. This quick stain is awesome for most things, but it's not great at staining the granules inside mast cells and basophils. To the untrained eye, they might just look empty. So if you even suspect you're looking for those guys, you have to remember this stain won't cut it, and you'll need a different staining method.
The slide is made, the cells are stained, and now it's the moment of truth. Is it any good? let's look at how you can be your own quality control and tell a great smear from a dud.
You know, you can tell a perfect smear just by looking at it, no microscope needed. It should cover about 2/3 of the slide, be totally smooth, and most importantly, it should end in this beautiful, smooth, curved, feathered edge. And here's the best part. If you hold it up to the light just right, you'll see a little rainbow sheen right at that edge. That's the chef's kiss. That's what you're looking for.
And yeah, when you see them side by side, there is just no comparison. On the left, that's our goal. Smooth, beautiful, with that delicate feathered edge. On the right, well, that's what we want to avoid. All the common mistakes like ridges, holes, or smears that are way too short or way too long. And these aren't just ugly, they make a real diagnosis nearly impossible.
But here's the thing. The best way to get better is to learn from your mistakes. Don't just toss a bad slide in the trash. Look at it. It's literally telling you what you did wrong. If you see ridges, it means you hesitated during the push. If it's way too thick and short, your angle was probably too high or your drop was too big. If you can learn to read your mistakes, you can fix your technique for the next one.
Because at the end of the day, that's what this is all about. Mastering this technique isn't just about making a pretty slide. It's about opening a clean, clear window into a patient's body. Now that we have our perfect canvas, we're finally ready to put it under the microscope and find out what secrets those cells are waiting to tell us.